On this edition of the Best Docs Network featuring Forest Park Medical Center, neurosurgeon Dr. Jeffrey Catarini, ENT Dr. Robert Wyatt, plastic surgeon Dr. Ricardo Mead, family medicine doctor Dr. Richard Berlando. Hi again, everyone. I'm Candace Kruger along with Jim Knox, and we're back again with another edition of the Best Docs Network featuring Forest Park Medical Centers. Of course, Forest Park Medical Center is one of the premier medical centers in all of the Dallas-Fort Worth area.
Exactly right, Candace. Forest Park Medical Center is not only one of the top medical centers, as you said, but also some of the best physicians in the entire Dallas-Fort Worth area operate right here out of Forest Park Medical Center. Like our first physician, neurosurgeon Dr. Jeffrey Catarini.
My brother was diagnosed with glioblastoma tumor, and I started visiting him in California. And after the removal of his cancerous tumor, I started realizing I was having some issues with myself. Felt like a light pulsating headache, but it wasn't painful. A little bit of pain in my calf, and my neck was just bothering me. I saw my chiropractor. After about a month, he said, "Stella, I'm really good at adjusting necks, but for some reason why you're still having some issues and not getting any relief." He says, "I highly recommend you get an MRI." After about 2-3 weeks, I went ahead and agreed because the pain was just too painful. He calls me up a couple days later. He said, "Stella, you're right. You have some neck issues. You have 2 bulging discs, but in addition to that, you have a tumor."
Spinal cord tumors fall into 2 main large groups. One in the canal, which is what's called intradural extramedullary, but it's inside the covering of the spinal cord and then pressing on the spinal cord from outside. And then another one is intradural intramedullary, where the tumor is within the covering of the spinal cord and then within the spinal cord substance itself.
And he explained the longer it stayed in me, it's going to press more and more against my nerves, and that's why I'm going to start to have more and more problems. "Dr. Catarini, if I was your wife, what would you suggest?" And he said, "Immediately take it out," and that's exactly what we did.
This is a model of the back of the skull, and then the front of the neck, and then the back of the neck. Stella's tumor was within the spinal canal itself. It was actually within the spinal cord itself. It was at the C3, C4 level, and these are lamina that were removed. We removed 2 of the lamina, making a small incision, localizing it here, opened up the covering of the spinal cord, and then went directly into the spinal cord itself to remove the tumor.
I just feel confident that whatever I had or whatever I may get in the future, I know I would always rely on him or go back to him.
Radiology departments are very commonly in hospitals. The difference here is that this is primarily a surgical hospital, and our primary purpose is to support our OR. We've got 14 OR suites upstairs. We have both pre and post-operative imaging.
Here at Forest Park, I work more closely with the staff members, kind of the segue between the director and the technologist. I'm here with them daily, supervising what rooms they're in, what exams need to be done, what tech goes to what assignment.
We're a full-service outpatient facility. We have an MRI here that's called a short bore. What that means is it's not as coffin-like for patients. It's more open. We also have a CT scanner here. It's a 64 slice that is capable of doing cardiac as well as any other CT imaging that you might need. And it's also an interventional radiology CT scanner, meaning we can do procedures that normally would have had to have been done in another room and then brought to CT for scanning. We can do both on the scanner at the same time. We have an on-site radiologist from RCA They read all our imaging. We have an on-site ultrasound unit, fully capable of doing general ultrasound and vascular, and I also have a staff member that can do both.
Here at Forest Park Medical Center, we work closely with some of the best surgeons in the area. They're definitely top-notch. We do what's best for them, and we make sure that we have all of the equipment necessary, all of the reps that they need to make sure that they get the job done well.
Our surgery suite encompasses 4 C-arms that can be used in a variety of times during the day, and our primary OR tech, who happens to be our lead tech here at this facility, is Stephanie Woodley. And she has not only taken the bull by the horns here at this facility, but she's also trained each of the other staff members that work in OR and has done a phenomenal job in that capacity.
If we're doing spinal fusions, that screw placement is very important, and we need to make sure that those screws go in exactly where they need to be. And imaging has everything to do with that. If our image is wrong, then those screws could be placed incorrectly. So we work very closely with the surgeons to make sure that we have the right image that they need, to make sure that they can place the screws correctly in the spine where they need to be. We're actually imaging during the surgery and assisting the surgeon to make sure that he's guiding his tools into the right, proper anatomy to make sure that he's doing it where he needs to be.
I really firmly believe that we have state-of-the-art equipment here, and I've got a top-notch staff that can really meet any of the referring physicians in the community's needs.
Best Docs Network featuring Forest Park Medical Center. Forest Park Medical Center, extraordinary in every way.
At Forest Park Frisco, we are 14 ORs and 2 suites for endoscopy. They all have the latest equipment for our physicians in there. Technology is something we do very well. We certainly go out and research the latest equipment. We're able to respond to our physician needs for equipment very quickly. The team at Forest Park Dallas started planning for this about 2 years ago. All the different departments, all the equipment. So it's been a very collaborative between the 2 facilities.
The things that make Forest Park unique are our focus on what's best for the patient and what's best for the physician. As a smaller organization, we have the opportunity to turn very quickly. If a physician has a need, a surgeon has a need, we can meet, we find a way to say yes.
I like the idea that we could form something from the beginning and make it our own rather than fall into a mold that was already there. This was something we could develop ourselves.
We feel that we raise the bar for healthcare. We're excited about what that can mean for the entire Metroplex as we continue to replicate that as we expand. We've seen that here in Dallas, and it's happening in Frisco, and we expect to see the same thing in Southlake and Fort Worth.
Did you know that Forest Park Medical Centers are designed and constructed to meet or exceed the standards of the U.S. Green Building Council's Leadership in Energy Environmental Design LEED program? The purpose of LEED is to reduce energy and resource consumption, minimize environmental impact, and provide healthier, more connected buildings. Throughout the building and grounds, you will see signs which highlight Forest Park's sustainable efforts.
Sleep disordered breathing, or commonly known as obstructive sleep apnea, is a fairly common, debilitating, and sometimes life-threatening condition that afflicts a fairly significant fraction of the U.S. population. The term apnea refers to the cessation or the slowing of breathing for 10 seconds or more, and is frequently noted or noticed by the bed partner as gasping or choking the patient.
My wife would say, sometimes I think you're dying, you know, and I'd ask her why, and she said, because you'd be breathing real heavy, and then all of a sudden you would just stop.
As this airway space narrows, and the most common reason is during sleep, the individual loses muscle tone. When that patient loses muscle tone, the tongue falls back in the airway. The procedure that I commonly perform and that was performed on Mr. New is what is referred to as the tongue and hyoid suspension. The tongue and hyoid suspension utilizes a device that inserts screws in the inner surface of the mandible. These screws have attached to it a very strong suture called proline, and that suture is placed around the hyoid bone. The hyoid bone is attached to the lower base of the tongue. This brings the hyoid bone closer to the mandible, opening up the posterior airway space. In addition, there's another suture that's passed within the tongue, and that holds the upper base of the tongue.
Now it's just you wake up, you're just refreshed because you have, gotten sleep. I noticed after my surgery, I fish a lot. When I got on a boat, the wind would go through my nose and would just be going down the back of my throat because now that passage is open, and it was just a totally different feel than you ever felt. There was lots of times when I would fish before that I'd be like, I'm just too tired to go. I don't want to mess with it up. Now it's not like that. It's like, if I got a chance, I'm going, even if it's just for a little while.
The Best Docs Network, featuring Forest Park Medical Center, showcases their fine facilities and their amazing physicians, like our next doctor, plastic surgeon, Dr. Ricardo Mead.
Courtney is a classic revision breast augmentation case that had had a series of failed operations.
Sometimes it could be painful, especially lying down. Not wearing a bra was not an option for me. I would even sleep in a bra 24 hours a day, always wore underwire.
The planning was intact. It's her tissues that were just structurally not sound. And if you need to reinforce tissues, then using this product will completely change her outcome.
With Dr. Mead, he was very confident, he was very kind. This has obviously been something that's been very self-conscious for me, so I felt very comfortable in talking about the issues with him. I felt confident that he knew what he was doing, that he had experience in doing this, and even after my consultation, his office staff was wonderful in trying to accommodate everything and make sure that this surgery could be possible for me.
It's almost like a push-up bra that you can't see in there. So at this point, I've figured out, I think, right where it needs to sit. I've been very happy with those results. In Courtney's case, it was a home run. I mean, the problems that she came to me with, although previously would have been problems where I might have just turned the patient away and said, I can't help you, I don't have the skills needed for this. With the problem list that she came, I knew I just check-marked each one down the line. I thought, we can fix this.
I'm still in recovery somewhat, so I have to be a little bit careful, but I'm back to running. I can stand up and feel comfortable, and not only has my self-esteem drastically improved, but I feel like I'll actually be able to do things like a normal person.
With this product, I can reposition the breast implants, and that's an opportunity for her to change out her breast implants. Maybe she did saline, wants to switch to silicone.
The first time I actually saw the finished results and I took the bra off, I couldn't be happier. I mean, I was just ecstatic, and this procedure has drastically improved my lifestyle. I'm much more comfortable. My self-esteem has improved, and I couldn't feel better.
I've been a member of a band called Master Bones Jangle, and the Voodoo Island Cannibals were actually a pirate band. There were several times in which I've had to miss entirely the ability to go out and play with the band that I'm in and enjoy those things. Not to mention the fact that several times, band aside, I've got a 3-year-old, and more often than not, I couldn't play with him, I couldn't pick him up, I couldn't interact with him. He would crawl up into bed with me and he'd say, Daddy's sick, and he'd get his doctor kit out and try to make me feel better, but there's nothing you can do.
In this particular patient, she had multiple recurrent episodes of diverticulitis. Diverticulitis is an area where there are inflamed or infected pouches or outpouchings of the wall of the colon.
When I first came to see Dr. Macaluso, I was experiencing a lot of abdominal pain. This went on for quite some time until finally my primary care physician referred me to Dr. Macaluso.
The most common area to get diverticulitis is what's called the sigmoid colon, which is on the lower left side of the abdominal cavity and in the pelvic region above the suprapubic bone.
Unless you are having those kinds of pains, unless you are really understanding what kind of agony that is, you don't realize how good it is to simply not be in pain.
A lot of times this can be treated with medications such as antibiotics. However, if you continue to have multiple recurrent episodes of 3, 4, or 5 episodes of diverticulitis, or the attacks of diverticulitis become more frequent in time, these are the patients that we typically recommend they undergo a laparoscopic colectomy.
My recovery time was minimal at best. I was out of the hospital before the weekend was over and my surgery was on a Thursday.
The small incisions allow for quicker return to work, quicker return to normal activity.
I can actually bend down and play with my son and not worry about having to lay on my back to try to find relief from the pain. From the time in which I met him to the pre-surgery procedures, the post-surgery procedures, and then the follow-up thereafter, he's almost been like a friend. I would absolutely recommend him to anyone going through this.
For more information on Forest Park Medical Centers and, of course, Candace, the outstanding physicians that operate right here out of Forest Park Medical Center, you can head to the website, click on bestdocsnetwork.com, and go to the Forest Park Medical Center tab.
Yes, and Forest Park Medical Center and their physicians are dedicated to helping change people's lives. Like our next doctor is Forest Park physician, Dr. Robert Wyatt.
Prior to coming to see Dr. Wyatt, I was constantly clogged, my nose, constantly having to blow my nose. I was carrying toilet paper around with me constantly and was just miserable. I couldn't smell at all, had a hard time tasting, and it really affected my lifestyle.
Jenna has been a patient of mine for a long time now, and she has very serious problems with sinus infections, sinus polyps, allergies, and associated problems with asthma.
I wanted to find out what was going on so I could breathe better and be functional.
She has a lot of problems with chronic sinusitis, with the formation of a lot of polyps. It's driven by her allergic disease and underlying inflammation that she has all the time. One of the big problems she has is something I see very commonly where sinus problems are making asthma worse.
He explained to me that I had a lot of polyp development in my nose and that he needed to remove them so that way I could breathe better and that way everything would flow more clearly and I would be able to smell as well.
So one of the things that happens to her when her sinuses start causing trouble is her asthma gets a lot worse. I would never be able to cure her, but I would be able to dramatically improve her quality of life by cutting down on the medicine she had to take all the time, improving her breathing through her nose, her sense of smell.
Dr. Wyatt has changed my life in many ways. First of all, being able to smell my own perfume. Yeah, he's definitely changed my life. I can taste food again, I can make trips with my husband, and I can have a normal life. I love being able to smell flowers.
And she's one of those people, unfortunately, that I have not been able to go in and cure with a single surgery, but because of the minimally invasive techniques that I'm able to employ now, even though she requires surgery to clear out polyps every 18 months to 2 years or so, she's able to get that done and tolerate that with very little downtime.
He is a great doctor. I love that he explains things to me well. He shows me things. He helps me out with new medications if I'm on them. He coordinates really well with other doctors. I just love Dr. Wyatt and his team. I would definitely recommend Dr. Wyatt.
One of the most common problems that a lot of women do not know much about, or a lot of women haven't even heard of it, is a condition called polycystic ovary syndrome. Women who have irregular cycles, or they have a history of missing a lot of cycles, or they have overt pelvic pain, are often found to have this condition.
Before I came to Dr. Lux, I was having a lot of irregular periods and I couldn't even walk sometimes because my pains were just really, really bad. They were sharp and just getting around, it was just really hard for me.
Now in Marley's case, she came in about a year ago with symptoms that are very typical of PCO, and that consisted of irregular cycles and pelvic pain. We did an exam, pelvic sonogram. Turned out that she has polycystic ovaries, and she also had some findings I thought might be typical of some other conditions that can cause pelvic pain, such as endometriosis.
So Dr. Lux sent me here and had the sonograms. And then after I had the sonos, and it showed that I did have the polycystic ovaries, which was cysts around my ovaries. I had one big cyst, but then I also had several different little ones too.
Treatment of PCO and pelvic pain consists of a surgical option versus a conservative option. It depends on what your goals are, it depends on the severity of the symptoms. In her case, she was in pain and she wanted to do something about that.
I went in the Thursday before and had the pre-op, and then after I had the pre-op done, they kind of told me, you know, how long I was going to be out of work, and which is I was only out of work a week. I was there like probably an hour after the surgery in recovery, and then I was able to go home that same day. If any woman is having pelvic pains, I highly recommend seeing Dr. Lux.
For the last about 10 years, my life had been slowly getting smaller and smaller. I was unable to walk. My weight had ballooned up during that last year that I was unable to walk, and I had been wanting to look into the weight loss surgery for several years.
Obesity has been told to cause approximately one article about 86 diseases, but it also appears to be a risk factor for at least a dozen cancers, particularly some of the female cancers. We know that some of the cancers that are particularly hormonally related, such as breast or endometrial or uterine cancer, is exacerbated because of probably some of the extra hormones that people get from the extra fat cells.
I had many health issues that were going on in my life. I had diabetes, I had high blood pressure, I had what's called metabolic syndrome. My waist was larger around than 6 feet, and I was unable to walk due to osteoarthritis. I had discussed many options for the weight loss surgery with Dr. Davidson in his office, and the gastric bypass turned out to be the best option for me.
So what I like about bariatric surgery is I love to put diseases into remission so that people their atherosclerosis or their hardening of the arteries doesn't progress because they don't have their diabetes and all the inflammatory responses of the body that you get from the metabolic syndrome with being overweight. I also like bariatric surgery because it actually decreases people from getting cancer. Well, my feeling is that weight reduction surgery should even be used as a means to both prevent and improve the prognoses of people that have cancer.
I really enjoyed my time with Dr. Davidson. He is a straight shooter. He is a very intelligent but a very kind person. He lets you know exactly what you can be expecting, and he is a perfect partner in the weight loss process with you.
For more information on Forest Park Medical Centers, as well as the outstanding doctors that operate right here out of Forest Park Medical Center, head to the website, bestdocsnetwork.com, and click on the Forest Park Medical Center tab. Right now, it's time to head to our next Forest Park Medical Center doctor. It's Dr. Richard Burlando.
Yeah, I have a long history with Dr. Burlando. And normally when I come in, it's congestion in the bronchial tubes and stuff, which from asthma and stuff, I'm used to it, so I kind of know my body and stuff, and I get right in and stuff. Drove home 1,000 miles each way, and I came back, and I thought I was just getting a little sick again. So I called him, and he said, come in, and he did what he does. And Dr. Burlando said, Dallas, I think something else is different. I don't like this. So did an EKG, and he didn't like the way that looked because it was different from the last time. They did an angiogram, and they were like, you can't leave. And I'm like, what do you mean I can't leave? He said, well, you don't have to have it. He said, but you won't have a heart attack and go through rehab and get better. He said, you'll drop dead. So I stayed in the hospital and did open heart surgery. And thanks to Dr. Burlando being observant, I'm here.
The worrisome thing about Dallas when he came in to see me was he has asthma. And we were just assumed that this was another asthma episode, but the characteristics of this pain were a little bit different. And I said, gee whiz, we've got to do a little bit of diagnostic testing here. And sure enough, Just had to get him in with the specialist in a real punctual fashion to get this looked at, and thank goodness we had intervened early. As much as early detection is important, prevention is the key here, and that's what we're all about in our practice.
When I went to the ER, I came right in, they did a echocardiogram, and they did another test and stuff, and those were fine. They did the angiogram, and once they got started, he like, we got a problem. And once he said we got a problem, he showed me what the problem was, and Sunday morning, 7 o'clock, they came and got me and did the surgery, had a double bypass.
And that's the thing about coronary disease, it can really play for keeps, and we just have to be so diligent about this, the guys especially, after age 40, so we can keep them out of trouble.
In general, I feel good. You know, I'm up every day, I go to work every day. I think I've used 2 sick days in 2 years, you know, don't miss work, you know, I'm good. Yeah.
For the prevention of coronary disease, a number of things come to mind. Very aggressive smoking cessation will often help people with some of the improved medications.
If you have an inclination something's not right, follow your first thought. Go get it checked out.
Best Docs Network featuring Forest Park Medical Center. Welcome to the 21st century of cutting-edge medicine. Forest Park Medical Center.
Before I came to see Dr. Pero, I was suffering with chronic sinus infections and congestion and facial pressure, pain. So my family doctor had referred me to him to correct these issues.
When a patient comes in and complains of not being able to breathe, you have to address it in 2 different manners. The first is, do they have a functional problem? Is there something that is going wrong with how the nose is supposed to function? And the second one being, is there an architectural problem? Is there physically something in the way that needs to be corrected in order to improve the problem?
After Dr. Pero examined me, he ordered some imaging studies, and this showed that I had a deviated septum.
So when Ann first came in to see me, we talked primarily about the function of her nose. She had a pretty severe deviated septum to one side that was clearly blocking not only her airflow, but was also contributing to some recurring sinus problems that she had. And so ultimately we discussed correcting the deviated septum to correct not only the airflow through her nose, but also to help her with her sinus problems. At the same time, she had concerns about the external appearance of her nose, and so we addressed performing those at the same time, which for a number of reasons is not only easier, but technically beneficial to do at the same time.
Along with the surgical procedure for the repair of my deviated septum, I inquired if Dr. Pero could repair a small bump that I had on my nose. All of my family has it on my mom's side. I've always been extremely bothered by this bump, and he said sure, it would be a very simple thing to do, and I'm very pleased with the results.
So ultimately we did that. We addressed not only the outside shape of her nose while also addressing the inside of her nose. We were only not only to improve her nasal airflow, but also correct her chronic sinus problems as well.
I'm forever grateful to Dr. Pero for fixing those issues and getting rid of the bump, helping with my self-esteem and loving my look a lot more.
Recovery is well tolerated. Typically we tell patients to expect to be out of work for 3 or 4 days. That could be up to a week in some patients' cases, but it just depends on the patient.
Dr. Pero and his staff, they're very helpful, and this made me feel very comfortable and confident going into the surgery.
Well, that'll do it. That'll wrap up another edition of the Best Docs Network featuring Forest Park Medical Centers. With unsurpassed service, exemplary care, and the highest quality medical facilities, prepare to have your expectations exceeded.
And to find out more about Forest Park Medical Centers, as well as the outstanding doctors that operate right here out of Forest Park Medical Centers, head to the website, bestdocsnetwork.com, and click on that Forest Park Medical Center tab.
And if you have a question or comment, we'd love to hear from you. Please send us an email at info@bestdocsnetwork.com.
So long, everyone. We will see you next week.